meeting is being recorded.
Hello, everybody, and welcome to our very special webinar today with Health Consumers New South Wales and the New South Wales Minister for Health, the Honourable Ryan Park MP. My name's Anthony Brown. I'm the Executive Director of Health Consumers New South Wales, and I'd like to welcome you to this webinar this morning. Before we start, of course, I would like to acknowledge the various traditional Aboriginal and Torres Strait Islander lands and waters the people are joining us from across New South Wales and Australia. I'm on Gadigal land this morning, and I pay my respects to elders past, present and emerging, extend that respect to the elders of all the different lands where we're on today, and acknowledge and welcome any Aboriginal and Torres Strait Islander people who are joining us today. I would also like to give recognition to the importance of lived and living experience. The lived and living experiences of people that people have of illness, disability, being a carer, using healthcare and recovery are all vital. The voices of people with lived and living experience are powerful and absolutely needed to make healthcare better. We value and respect the experiences that everybody brings today, and we thank everybody who's involved in bringing their lived experiences to make health services, healthcare, health policy and health research better. So thank you all for joining us, and a special welcome to the Honourable Ryan Park MP, the Minister for Health, Minister for Regional Health and Minister for the Illawarra and South Coast in the New South Wales Government. Minister Park has a lifelong commitment to public service, and prior to entering Parliament, he was a high school teacher, and followed by holding a number of advisory and leadership roles in the education, transport and community sector. So as Minister, Minister Ryan's committed to building up our healthcare system so that people can receive the care they deserve and what they need, through improved access to care in our cities and, of course, in regional New South Wales. So welcome, Minister. It's great to see you today. And before we kick off and get into a conversation and our back and forth about what's happening, I'd also just like to let people online know how much interest there has been in this event. We have over 150 people who've registered for the webinar today. That could go up a bit more. And we've received almost 100 questions that people have for you. So as important as all those questions are, obviously, for people who've put in questions, just want to let you all know that we just unfortunately won't have time to get to all of those questions. We will put any questions that we've received that we don't, that we're unable to ask to the Minister, we'll forward those to the Minister's office to be taken on notice, and we'll get back to people who've asked those questions. We also have the question and answer function open on the webinar, and we ask people to please put in questions. This questions and answers has a function for people to vote on questions that they'd like to see. And again, we'll do our best to get to some of those questions as well. We've also got the availability for people to make live posts on social media about the webinar, and we invite people to do that. The hashtags that they can use are displayed behind me, and we'd invite people on X, Facebook and other social media if they'd like to make comments. We've got some staff members standing by who are part of those online conversations as well. So with all of that background, welcome, Minister. And Minister, I'd invite you to please, if there's any opening remarks that you'd like to make about current healthcare policies and priorities, and particularly around collaboration with consumers and carers in the healthcare sector.
Yeah, no worries. Thank you, Anthony, and thank you to Health Consumers New South Wales. I've had a long relationship with Anthony and the crew, had an opportunity to be the Shadow Health Minister for 4 years, so it was a very good apprenticeship and an opportunity to engage with Anthony and the Health Consumers New South Wales group through that. And they're a very valuable member of our consumer advisory groups across a range of different areas, and we really value the input from health consumers. I too would like to acknowledge the traditional owners on the lands on which we gather. I'm on Gadigal land, but I represent Dharawal land from the Illawarra, but I acknowledge elders past and present and the contribution they make to our health system, but also recognise the gap that still exists between the healthcare and the health outcomes of Aboriginal people and those non-Aboriginal people. Today, I want to just talk to you about perhaps the importance I give groups like this and the importance that I give consumers' voice into everything that we do. And I want to try and demonstrate that through a variety of different avenues. But can I say this from the very beginning? I don't think consumers' voice should only be heard through a system of complaints or feedback. In fact, what I believe in, that consumers should be upfront, part of the development, whether it's policy development, infrastructure development, service level development, whether it's development about population health or the challenges in medical research. In fact, one of the first questions I often ask my public servants is, how do we know what we're doing is working? How do we know it's meeting the needs of people on the ground? And one of the things that I do a lot is engage directly with clinicians and through their consumers, and directly with men and women using the healthcare system. And I do that through a range of different ways. But one of the ways in which I do it, and I'm doing it later on today, is do unannounced visits at our hospitals, where I have an opportunity to meet firsthand not only clinicians, but often patients waiting in an emergency department or patients waiting in another part of the hospital, get some feedback about what's happening in real time, because you can't get that experience through a controlled environment. What you often have to do is put yourself in the position of a consumer and work your way through that system. Now, this morning I was reading some correspondence, because my office will tell you I read all of my correspondence, which is where I get a lot of feedback, obviously, from. And one of the pieces of correspondence I read this morning was from a gentleman in Orange. His name was Charles. Obviously, I won't give his full name, but his name was Charles from Orange. And Charles from Orange had recently been a consumer in our healthcare system. And whilst he acknowledged the care that he got was very good, one of the things Charles talked about was the challenges around food and the type of food and the quality of food and what that did to his experience. Now, Charles was in there for a sustained period of time, and he was saying through his correspondence to me that the variety of food is problematic, the way in which it's presented, in his view, is problematic, and the way in which he believes we could be doing better is by not doing so many things in plastic disposable ways through food, and get back to what traditionally was done perhaps in hospitals 30, 40, 50 years ago, which is around normal utensils, normal cutlery, etc. Now, why I say that to you is this, is that in a $35 billion portfolio, you could, and be very careful to not forget that the Charleses of the world often give you a really good insight into what's happening. Now, Charles might be one of 100 who have that view, or he might be one of 5. His suggestions may or may not be able to be implemented for a variety of different reasons. But the fact that we hold that in really strong importance in my office, and the fact that I want to see every piece of correspondence that people write to me on, gives you a sense of how driven I am to make sure that consumers are heard. Not all of their issues are resolved. Perhaps not all are resolved to the satisfaction that they would like, but they are heard. So that's one component that I feel very, very strongly about. The other component that I think where we need to do better is having consumers up front in the development of services and the development of our infrastructure. Now, we're starting to get better. If I take the infrastructure piece, we're starting to get better at having what I would call the users, the clinical staff, embedded in the development of our new facilities and new infrastructure. What I think we need to get even better at is bringing consumers into that process from the front end. And why I say that is this, is because I had an opportunity in one of my unannounced visits to meet a mum who was at Westmead, and she was there because her child was quite ill and she was going to be there for a long period of time. She talked to me about having charging stations, more charging stations for phones and iPads. Now, I wouldn't have thought of that. Had I not had an insight into that mother's world and viewed that world, I wouldn't have had an insight into that. But as she talked to me, you could tell the importance and the benefit that would bring, and the ability to make sure they don't have to find PowerPoints, etc., all the time to get phones and devices charged, because she was saying she was forced to work from the hospital for that period of time. And all of this, while she's not directly the consumer, she's certainly associated with the consumer and an important part of the voice. And I say this because you've got to be careful, I think, in these big portfolios. There are a lot of big issues coming at you all of the time. But what you've got to remember, at the heart of everything we do is serving the community and delivering the very best healthcare we can. And I would like to think that we're an organisation that looks to continuously improve. We don't pretend that we have all the answers, nor do we pretend we have all the solutions. But I am determined to make sure that consumers, wherever possible, are at the front end of service delivery, are at the front end of addressing concerns and complaints, are at the front end of making sure that when we develop infrastructure, they're a part of that. But they're also at the front end of research and making sure that we're actually doing research that is helping the consumers within their community. So I'll give you an example. Recently, I had the opportunity to meet with the Ingham Institute out in southwestern Sydney. Southwestern Sydney, consumers of health and that population have some very, very high incidence of disease and morbidity for a range of different reasons. One of them is significantly around diabetes and obesity. That is a real challenge out in that community. Now, Ingham have made it a point of difference that they want to focus on the healthcare of that specific population in southwestern Sydney. They're not trying to be something that other universities or other research institutes are. By engaging consumers and engaging the population in their research, they now have a really great diversity of research participants, which is fantastic when you're researching, because it brings you a whole scope of population, something that researchers around the world would love. The variety of the population mix in that area is significant, and that is a strength when you're undertaking clinical research and clinical trials. And it's all about putting the needs of those consumers at the front end of their research. So they're not out there researching things that really don't relate to southwestern Sydney. And I think that's where we need to get better going forward. A hospital in southwest Sydney may be different to a hospital in Broken Hill, may be different to a hospital in the Tweed. The way in which we provide services out of that hospital, the way in which that hospital functions, has to be informed in part by consumers. And in the same way, schools perhaps 60, 70, 80 years ago were built around the interests of the educators and the teachers within that environment, and missing what it means for a student or a parent moving in and around and accessing the school. We need to start to get back to focusing on hospitals, not just for clinicians and medical and nursing staff, but also what those hospitals mean for consumers and for people who often, with chronic disease, have to spend a significant amount of time in them. A lot of people now are not going for acute illnesses. They're going for the management of chronic disease. That means they're in our hospitals, in our healthcare systems for a long period of time. So they have to be upfront in that process. I've been really pleased with the way in which health has engaged consumers in strategies like the LGBTIQ strategy, having them upfront about what that community needs. I've been really pleased in the way in which they've been involved in the Environmental Sustainability Committee that we've got in New South Wales Health, really focused on some of the issues that Charles brought up about plastics in our food. Is some of the work that we're actually doing now in places like Hunter, New England, to address the consumers' concerns around those particular items. They're an important part of what we do. And I want to say to this group and to consumers broadly that I don't think we should ever stop trying to get better at putting you front and centre. I think when you feel that you're not front and center, it's important for people like me to know about it and hear about it. I think when you feel as if you're not being heard, like people like Charles and the woman that I spoke to at Westmead perhaps was not being heard, I think it is important that people like I know, because we have a health system that, yes, it needs to be responsive to the needs of our clinical staff, but more importantly, from my perspective, it needs to be responsive to the communities in which we serve. And that means having consumers' voice at the heart of everything we do: policy development, infrastructure development, service development. And the role that Health Consumers New South Wales play as the peak in this is absolutely critical. Obviously, you're engaged with us through your various different panels and groups that we've got you engaged in at both a local, state and shared services model. But it's really important that you feel that you have access to me as the Minister, my ministerial staff, and the team at New South Wales Health. Now, we want to make sure that we're not putting our hands down and saying we've done everything. We're happy with that. We think we can do more. And I'm really pleased to announce that today we'll be giving Health Consumers New South Wales an additional $100,000 on top of what the grants that we already provide, with a focus on them rolling out their strategic framework and their strategic plan. Something that I know that is important to them, but something that more importantly is important to the way in which we deliver healthcare and our health system going forward. We are under enormous pressure now as a health system, the likes we've never seen before. We are facing enormous challenges in our emergency department. We are facing an increase in chronic care challenges, meaning elderly people are often trapped in our hospitals because they're unable to access aged care beds or NDIS packages, meaning we have access block into our hospital, and we have access block getting people through our hospitals. That's a challenge for us. What it means is we're going to need to be delivering more alternative pathways to hospital. And in that regard, consumers are even more front and centre, because this is about delivering healthcare in people's homes, in their residential aged care facilities, and in a variety of different meetings, whether it's hospital at home, whether it's virtual, whether it's our GP outreach and in-reach services. We need to make sure that what we're doing meets the needs of the consumers. Otherwise, our hospitals are forced to simply take everyone in, when in many cases, care will be best delivered in an environment where the patient is far more comfortable and the consumer is far more suitable to, particularly as that person gets older. So all of that is about saying to you, thank you for your work. Thank you for your engagement. We've got a lot of work to do together. We've got a system that needs to be continued to focus towards being reflective of the consumers upon which it serves. And I know that working with Health Consumers New South Wales and all of you will build a better health system in New South Wales. Thank you.
So thank you very much, Minister, for your thoughts and the announcements there. And obviously, Health Consumers New South Wales, we're very gratified and thankful for that extra support that will help us roll out our strategic plan. One of the things I'm really glad that actually you talked a lot about that issue around resourcing consumer involvement. It is something that a number of our members asked in their questions to us. We have almost 1,000 members who are experienced consumer representatives, consumer leaders, who are very involved and up for the challenge of making our health services better. And one of the frustrations we hear from many of them is actually how we achieve that very thing that you're talking about. How do we make consumer involvement upfront and the first thing that people think about with new developments? How do we embed those good examples like the development of the LGBTI plus health policy into business as usual in the health system?
Yeah, I think we've got to do better. And what I try and do is, when I see really good examples of this, Anthony, I try and make sure that it's shared around the world. I think around the system, one of the other things that I always will do here is challenge what's being presented with me and say, what are consumers saying about this? So I'll give you an example. I've been very, very keen around the need to roll out more virtual care services around New South Wales. A couple of reasons why. Our hospitals are under, as I said, enormous pressure. Our emergency departments, we need to look at more convenient ways for people to access it. But it's actually not just because of our problem. Some of the research that I've looked at demonstrates that the community wants to have more of these alternative pathways to hospital. Why? Because many families are very busy at the moment, and the ability to access hospitals in a timely way is not always possible. And particularly for those with young children, the ability to access virtual care, to get the comfort of virtual care in their home, to be able to get the reassurance that what they're doing is right, is something that the research and feedback about this is saying over and over again, people want. So what I was continuing to challenge health to do is, when we're developing virtual care services, don't just think about it through the methodology of the user and the clinical person who's going to deliver the instruction or deliver the advice. What I want them to do is think about it from a consumer end and how they will access it. So a classic example is this. We have in New South Wales and around the country, Health Direct, the 1800 022 222 service. In theory, a very good service. We're investing more into the back end for people to be able to ring up and get that service as an alternative to emergency department or hospital. But the problem with it is that consumers don't know enough about it and are not aware about that number. If I asked a family member of mine, and they're a family member of the health minister, do you know the Health Direct number? They couldn't tell me. If I asked the average nurse or doctor, they probably couldn't tell me. Now, that's a problem, because what it shows is that we've built a system that in theory should be working well and doing a lot, but is only operating in second gear when I need it to operate in fourth gear. And I need it to operate in fourth gear quickly, because I need to be able to capture not only the positive experiences that people are after through an alternative pathway, but I need to take pressure off our acute hospital beds and our acute services in our hospital by diverting people who don't need to be there. But the problem is, we as a system haven't made consumers aware of it. And if you have a look at some of the breakdown, like I have, of where consumers are even least aware of it, it's actually where we need them to be most aware of it. So where some busy hospitals are in southwestern Sydney, we have a very, very low rate of people engaging with Health Direct. That's a classic example of putting the cart before the horse. We've got a good model. What we haven't done is brought consumers with us.
Yeah, and one of the things we'd be happy to help with, Minister, is looking for ways that we can get consumers involved in the design of those messages and also the services to start with. And of course, consumer involvement's not just about involvement in co-design, as important as that is. It's also about bringing consumers, carers, community members into governance structures. And again, one of the things that has been mentioned by a number of our members is the inconsistency when we look between different local health districts and specialty networks around how consumers are involved in governance, whether that's around the structures around things like district-wide advisory committees, or whether it's about even having consumer representation on the boards. Just be really interested in your reflections on how do we get more consumer involvement in the governance as well as the co-design.
Well, I've asked New South Wales Health to have a really good look at the board structure, Anthony, to be brutally honest. When I came into government, I don't think it was serving the purposes of what they're meant to do. I'll give you an example. We're in a fairly highly feminised workforce. Around 70-odd% of our staff are female, yet we probably had about 11% of our board members were female. You can see straight away how that is out of kilter in the way in which we deliver services. We've been able to bring that up through a targeted intervention from my end to around about 40%. And what I've also asked the districts to start to look at is how we have exactly what you said, more consumers or more people with lived experience on our boards and in our board structure. Now, everyone has to play a board, and we need a certain skill mix, and we understand that in a corporate governance world. But we also have to make sure we have people who have real life experience, in recent experience, engaging with the health service and what that means for them. So one of the things that we're going to continue to look at doing is, from a governance perspective, increasing the amount of lived experience on our governance structures across New South Wales. I've made it clear that I want patient voice to be at the heart of what we do. If we don't feel we have that, then I want to know about it, and I want to know what we're doing to address it. We're not going to build a better health system by just focusing on the needs of clinicians. What we're going to build a better health system if we look at it as a true ecosystem, which is a combination of a range of different factors that we have to input into developing the best model that we can with the resources that we have. And I think governance is important. I think the way in which our board structures have traditionally run don't serve consumers as well as they could. I'm not convinced yet that there is strong enough consumer voice on our boards. It is a work in progress. In the same way that we have tried to get more diversity across the board spectrum, we also need to significantly increase the consumer voice and the lived experience across our structures, both at a board level and at our various committee structures level. So I think it's a work in progress, Anthony, from my perspective.
No, thank you, Minister. And of course, we know there's many consumers and people with lived experience who bring a vast amount of governance knowledge and experience to the table as well. And again, it's conversations that Health Consumers New South Wales is very happy to be involved in. And of course, at Health Consumers New South Wales, we can't do this by ourselves. You mentioned that we're a peak organisation, and of course we have also close to 60 member organisations who are looking after the needs and interests of some of the condition and population-specific groups who use health services. We do our best, and as part of our role as a peak, to provide them with support and advice, but many of them are also struggling to have their voices heard and to amplify the issues for their particular consumers and members. I'd just be interested in your reflections around how we can help build the sustainability and longevity of some of these really important but very sort of small consumer groups.
Yeah, look, I think what we firstly have to do as a system is value them, making sure that I've found in discussions with some of the consumer groups that they feel a couple of things. One, they just feel overburdened all the time to asking all the time for engagement in specific things. I don't think that is helpful. What I've told health to do is to not put undue burden on people who are generous enough to be providing some of their insights, but to be utilising these groups in not a reactive way, but in a strategic way better. And what do I mean by that, Anthony, is I don't think we're still yet at a stage where we're putting enough consumer voice at front end of the development of service, infrastructure, and models of care. Now, that's not a criticism of my own department. I think it's an evolution of the department, and that traditionally it's been a bit top down, and it's about the loudest clinician in the room gets focused on the most. What I want us to do in dealing with consumer groups is not to be overburdened on them by asking them everything and every feedback and every consultation upon every single component. I don't think that's fair, to be brutally honest. What I do think we need to do better is when we're setting up new clinical services, when we're about to engage in a research platform, when we're about to engage in the development of new infrastructure, then having the group at the very beginning as a part of that is important, but setting down the parameters for engagement so they don't feel that they're overburdened by having to respond the whims of a various public servant along the way. I don't think that's fair, but I think it's more about making sure that we properly resource and support these groups, make sure that they feel that they're a part of the system, make sure that they feel when we have the big conversations, they're not a ticker box, but they're actually a valuable member of that input. And we're going to show that we value them by actually not burdening them with every single issue that we feel that we have to engage on. I don't think over-engagement, I think over-engagement is just as bad as under-engagement, if you want me to be brutally honest. And it's not something that I want to see happen, because I think it puts undue burden on people who've been generous enough to provide lived experience input into a really, really complex system. So I think we've got to value that input by having it at the front end, by making it clear the way in which we're going to engage and the way in which we will come back to them to demonstrate how we've addressed, or if we haven't addressed it, why we haven't addressed some of the issues raised.
No, thank you. Thank you, Minister. And I think that brings up a really interesting point around, you mentioned the importance of building capacity and providing support to groups and providing and engaging in a sort of a sensible and a planned way. That's something we obviously support, but to do that well, there's also a need for knowledge within the system and within services about what are effective and meaningful ways to engage. We have very well-meaning processes and well-meaning staff members who reach out to get people involved, often at a time when we feel like it is a little bit too late, or in a way that is a bit clumsy and not always safe ways to engage with people. And I suppose I'd be very interested on your thoughts around ways that we build the capacity of the system to do this well, how educating people about good processes and safe processes, and other ways we can support building system capacity to do this in safe and meaningful ways.
Well, I think this has to be at every level. I think at a board level, for example, there has to be clear policies and guidelines developed and enshrined into the way in which they as a board need to engage with consumers. Now, I think some boards, certainly from my knowledge and insight into them, and I engage with chairs a lot, some of them have that really strong. Some of them don't. I think at a clinical level that we need to make sure that we have the engagement as we develop services. Well, what is this service doing? Who is it designed to please and cater for? And are they involved in that discussion? If we don't have that at the front end, we're not going to deliver the service. So a classic example is a range of different diabetes services that are operating in rural, regional, and remote areas. Now, by engaging with community at the front end, they've been actually able to work out how often they need to deliver those services. Can they actually train their consumers to actually deliver the service themselves in their own way, so they don't have to come in and maybe drive a couple of hours, sit in a chair and get that dialysis done? Can we do this in a way that they can do that at home and learn to do that at home? That's an incredible way in which that health service has engaged directly in the users and not said, no, we expect you to come in here because that's the easier for us. They've actually said, we're delivering a service for you. What is the way in which we can make sure that that service is delivered safely, of course, but also conveniently and efficiently and effectively for you, the consumer? So from my perspective, Anthony, I like to see the role of consumers at every single level of our hospitals, our ministries, and our health services. Now, some do it very well, some don't. Some engage consumers too often, some engage consumers not enough. Difficult to say how you would roll out perfection across the board because you're dealing with 170,000 staff, all of which have different personalities and quirks and whatnot. But I think as best we can, embedding good policies at a board level, at a senior management level, but also at levels like a NUM, a nurse unit manager, within our hospitals, that middle management, that critical level of management that I argue is the most critical certainly within our hospital system. What professional development are we providing them to be able to make sure that they have a radar to engage consumers? So, for instance, one of the programs that I'm very keen, and we're in discussions at the moment about whether we can continue to do this, is the patient experience officers that exist in some of our emergency departments, and I'm sure you and some of the consumers are aware of, Anthony. Tough fiscal environment at the moment, but we're going into bat for continuation of them, because the research and feedback that I've got, both from consumers and clinicians, and I've had many, many people on both sides write and inform me about these, is that these people have an enormous role to improve the consumer experience. Why? Because they're not clinical deliberately, but they do help navigate what is often a very, very complex service. They have been particularly well received in the culturally and linguistically diverse communities of southwestern Sydney, whereby some people enter into our hospitals and health services with not a high literacy level. These patient experience officers have often been able to calm people down, reduce their agitation and frustration, simply by explaining the way in which they will be moving through the health system. For some of us, that would seem first nature and something that we would take for granted. Perhaps even me, I wouldn't have thought it. But having engaged with this group for a significant period of time, I think they're worth fighting for keeping. And I think they play an incredible role to making sure the consumer experience is enhanced in our health and hospital system.
No, thank you, Minister. One of the things we've been involved in over the years actually has been looking at that issue around care navigation and care coordination more generally, and as a key way to make people's experiences in the health system smoother, because we know it's a very complicated system, as we all know, and having somebody who's there in your corner who can help guide you through that is really important. And we'd obviously advocate not just for these roles and liaison roles in ED departments, as important as they are, but elsewhere in the system, and help people connect also outside the healthcare system, because people who really need health services are often interacting with multiple different systems, be it aged care or disability services or whatever it is. So really pleased to hear that, because that's one thing, as I said, that we think is really important. I also wanted to, one of the things that has come up in some of the questions online has been around a lot of questions about access. You mentioned people from culturally and linguistically diverse backgrounds, and some of the issues that people from cult groups and others face accessing services, particularly in rural and regional locations. And I know there's a lot of work happening there, but I'd just be really interested in your thoughts and reflections on how can we make access to services for some of those groups who have difficulties now accessing services easier, particularly in rural and regional areas.
Well, it's a big priority. If we look at the rural and regional areas, Anthony, for me, we've got to do a hell of a lot better. What I've been engaging with the sector about, and we've now got in place in New South Wales for the first time a Deputy Secretary looking after rural and regional and remote, because I wanted a voice at the bureaucratic decision-making table that reflected the communities outside the metropolitan cities. And one of the things that we've been leaning right into is obviously around the way in which we roll out services to communities in remote areas, particularly around virtual care, but not virtual care in a way that is all about the person from Sydney just giving the instructions to the doctor in Broken Hill and that be it. But in fact, a real partnership between some of those hospitals in rural, regional, and remote areas and some of our big hospitals in tertiary hospitals in Sydney. So, for example, if you have a look at a virtual burns service that's run out of our world-leading Concord Burns unit in Concord, that service is partnering with hospitals and clinicians in far western Sydney to enable consumers in those areas that have experienced a burn to be able to be treated by their clinician in that area and not have to spend an enormous amount of time going back and forward from Sydney to parts of regional, rural, and remote New South Wales that have an undue burden of them, often result in their healthcare getting worse, reduction in their outcomes, and certainly big cost of living challenges. But to do that effectively, what the clinicians have done is made sure that there's a professional development component so that the clinician, if I'm the clinician in Broken Hill providing the care to Anthony, my patient, and I'm speaking to someone at the Concord Burns unit, that person is not just giving me clinical instructions, but they're also engaging with me both online and offline around professional development. They're also demonstrating to me, you can do this here. If we come and provide you some service here, you won't need us for this. Now, that is a true partnership between our big tertiary hospitals that we can't have in every regional and rural location across New South Wales, that we have to be realistic about. It's a partnership between our statewide specialist services that are often located in our large metropolitan cities. And it's a true partnership between them and rural and remote communities, because it's saying to them, we're not just going to tell you how to do it and then hang the phone up, so to speak, but we're actually going to help you help your patients. And we're actually going to improve the experience for consumers, because we understand that, like in Sydney, if we want to access healthcare, we drive 15, 20 minutes, half an hour. We understand that for people out in those areas, specialised healthcare is not 15, 20 minutes, half an hour, an hour. It can be many hours. It can mean overnight stays. It can have a huge burden on families, including the dislocation of families. And that is a real challenge for us, but is an example of what we're doing. I think in called communities, we are now starting to invest far more into providing direct funding to some of these small called community groups and leaders in those groups to establish, whether it's awareness campaigns around vaccines, whether it's awareness campaigns around when you need to go to an emergency, when you don't, whether it's awareness campaigns about women's health issues. What we've traditionally done is the very simple model, which is, well, let's translate the information and then that'll do. In fact, what we have to do is go and ask the consumers, where do you get your information from? Who do you trust where you get your information from? And then use those channels, fund those channels to properly deliver those messages. So it's a more nuanced way of really getting down to how do these various minority groups access their health advice and health information? Who do they trust? How can we plug into that and make sure that they're getting the very best advice and treatment possible?
Thank you, Minister. And of course, one of the other good things about strategies like that is that it's a way not just to make health communication and health services more effective, but also to hear back from those groups about what are their key concerns and issues that they think health services can help with. So it's not just answering health services needs, but communities' needs and what they see as important. And that issue around telehealth, our members tell us very, very strongly how many people really do appreciate the convenience of telehealth for those reasons expressed, and for people in rural and regional areas, but also that they don't want the provision of telehealth to be at the expense of important existing local services, whether that's GPs or patient transport or things like that. And that those local services, keeping local services going, is obviously dependent on having a strong and sustainable workforce. One of the issues that this won't surprise you that many of our members have raised their concerns about the sustainability of the health workforce, especially out of metropolitan areas. And we know there's a lot happening there, but again, be interested in your reflections on some of the key work that's happening there, and what are the roles that consumers and consumer representatives can play around this planning around creating a sustainable workforce.
Yes, thanks, Anthony. And it's probably the thing more than most that keeps me up at night is the workforce. I think ministers of all political persuasions in the past have focused on varying things. I think the former government probably put a lot of investment into hard infrastructure and new health facilities, and that's important. Not here making a political comment at all about that. I've decided and made it clear to New South Wales Health very deliberately and very directly that my focus is going to be on service improvement, and to do that, it has to be on workforce. So we have engaged now in a range of different initiatives to try and enhance, both attract and retain our workforce, both also to create a pipeline and keep people in our professions and in our systems. And briefly, to do that, we're looking at a range of different things and implementing a range of different various models. Obviously, in rural, regional and remote locations, I've increased the incentive up to $20,000 to locate people in regional, rural and remote areas, in areas that are hard to fill. But we're also investing for the first time significant funding, well over $200 million, into healthcare, housing and accommodation in regional, rural and remote. And I can tell you the one reason that we found out that that was important is because time and time again, when I was travelling across regional, rural and remote, both as a shadow minister and the minister, staff, but also consumers told me that, look, we lose a hospital, we lose a doctor or we lose a nurse because they've got nowhere to stay in our town, there's no accommodation suitable, we can't get rental properties, etc. And I said to health, we can have all the great ideas and incentives to try and attract people to these areas. If we can't house them, we're blowing in the wind. We're not going to deliver anything. So that initiative is going to, what I think, bear fruit later on. We're rolling out across our hospitals and our emergency departments initially, our ratio-based model, which is the largest reform of healthcare staffing that we've ever undertaken in New South Wales. That's important. Why? Important for consumers, because probably the most correspondence I get is saying that their experience wasn't great at a hospital because the nurses were overworked and didn't have time to be able to meet the needs of individual patients. We believe that rolling out a shift-by-shift, ratio-by-ratio model, we can enhance staff. That on turn has two benefits. It both helps to attract and retain the existing staff, but for me, from a consumer perspective, it is shown to deliver better patient care. So that is important. But we're also making sure that rural, regional and remote areas for the first time are going to be separated when it comes to the allocation of paramedics. And we are rolling out 500 specific paramedics just outside those metropolitan centres of Wollongong, Newcastle and Sydney to those regional hubs and rural and remote hubs, so their resources is focused. This came about because consumers were telling me of extensive delays accessing paramedic care out in rural and regional areas. And they were telling me they were concerned that in various seasonal parts of the year, when their population increased in those areas, they didn't feel there was adequate numbers of paramedics to help with them. What I needed to do was not have those large centres gobble up all of our workforce. So we ring-fenced 500 and we'll be rolling them out across New South Wales over the next few years. I don't think there is a more important thing than making sure that we've got a pipeline of healthcare professionals, i.e. we need the future health professionals coming into our system. And it's why we are rolling out $12,000 study subsidies for 12,000 healthcare professionals over the next 3 years to both attract and making sure that there is a pipeline of workers to deliver the health services that consumers need, particularly in rural, regional and remote locations.
No, thank you. Thank you, Minister. And just following on from that, and one of the issues around not just workforce, but access to primary healthcare and GPs, again, another issue that's very dear to the heart of our members and came up in a lot of questions. And with the current reforms in primary healthcare, we're interested in looking for the ways and to know more about that interaction between primary healthcare, the responsibilities of New South Wales, and that reform, and how we as consumer organisations and consumer advocates, can play an effective role there, because we sometimes get trapped as well in those state Commonwealth silos where we don't want to be, but we are. And I'd just be interested in your reflections on the best way that we can contribute to those.
Well, certainly at the moment, Anthony, we are in the middle of those very important discussions around the next National Health Agreement, which will go for 5 years, commencing from 1 July next year. I think it is the most important intergovernmental agreement a government at both the Commonwealth and state enter into. It's certainly the most important in relation to New South Wales, and it can have arguably the biggest impact on health services across the state. I'll give you an example of the challenges we're facing at the moment. Right now, as we're in discussions here, there's around about 760 patients essentially stuck in our hospitals for 50 days on average, more than what they were, their discharge date was. That's because they can't access aged care and they can't access NDIS placements. That's a huge problem and puts a huge burden on our system. And one of the things that we are engaging directly with the Commonwealth is exactly that. The state can't be expected to be doing all levels of healthcare delivery. We are responsible largely for hospitals. What we are finding ourselves doing at the moment, Anthony, is in order to provide consumers with more avenues to access alternative care, we are leaning into very much the primary care space. Now, that becomes difficult from a budget perspective because we're not funded to do that. So all of our geriatric outreach services, all of our urgent care services, they are critical because without them, our EDs would be overrun, but we're not funded to do that. And that's a responsibility of the Commonwealth government. At the front end, that's a challenge for us. At the back end, we have a challenge moving older patients out of the hospital and back into residential aged care, and moving NDIS patients into supported placements into the community. If we don't get those front end and back end right, as I keep saying to the Health Minister federally, it's very, very hard for consumers to have a quality health experience in our hospitals, because both of those contribute to big delays and big challenges in terms of access block. The front end component does, because if people don't access primary care, if they can't access a bulk billing GP, if they don't have access to specialist care to manage chronic conditions, they present to our hospitals not as a category 4-5, but a category 2-3 in terms of a triage. And their severity is far more, and the complexity and acuity of their case is far more severe than what it would have been had they had appropriate treatment. Likewise, if we can't get the back end right and we can't get people through the hospital, then it becomes very difficult to admit patients who really need acute care because of these blockages. These are big discussions that we're having at the moment, and Health Consumers New South Wales should certainly reach out to me. We haven't finished those discussions, but the feedback that I've got from groups like yourselves and others is that not being able to access primary care means in many cases the emergency department is no longer just for emergencies. It's for managing primary care and chronic care conditions that should be, in a system that's working well, managed out in the community.
No, No, thank you, Minister. And that certainly reflects, I think, the experiences of many of our members who want to maintain a good relationship with their GPs and see the importance of GPs as being as the people who are coordinating and supporting their care, but just finding and getting into an affordable GP at the moment is proving difficult for so many people. So we'll definitely be continuing those conversations. There's so many more things that we could be talking about. So many more questions coming in, and questions that we really haven't had a chance to get to. But I did want to finish up with a question around, and we may not be able to cover this in 4 minutes, a question around some of the various inquiries that are happening at the moment around healthcare. We've been involved in making submissions to some of those inquiries, as have many of our members. And I'd just like to hear your reflections on some of the most recent ones. I mean, the one that's come out most recently is the New South Wales birth trauma inquiry. I'd be interested to hear your thoughts about some of the findings there. But also, and I know we're in the middle of this inquiry on the Special Commission of Inquiry into Healthcare Funding, but be interested in your thoughts on what you think some of the key issues are happening there, and in terms of establishing that inquiry, what are some of the key questions that you're hoping that would untangle?
Yeah, touch base on the birth trauma one first, then a really important inquiry. In fact, many of the submissions came from the community where I'm very proud to represent. It's been a challenging inquiry for a government, but an important inquiry. What it highlights is that from a consumer experience perspective, we need to do a lot better. What I've been really pleased with New South Wales Health about is their willingness to engage with those consumers directly. So groups, not solely, but groups like Better Births Illawarra, we're actually engaging at a CE level in our local health district directly with this consumer group about how we can make the birthing experience for mum and bubs a lot better. That's a combination of a range of different things, Anthony. It is education at the front end. It is obstetricians and midwives having really important discussions and listening and learning about what the woman wants and what the experience thereafter, but then also talking to the woman about, well, what happens if this happens and what we might do if that, making them feel part of the actual process and not feeling as though they're a passenger in the birth of their child. And I think that's been a really important learning from New South Wales Health. Some of the issues we need to address there are actually cultural issues, and they're issues around power imbalance and about the obstetrician perhaps taking the view, not disrespectfully in any way, but taking the view as, I'm the expert, I need to keep mum and bub safe, this is what I'm going to do. Rather than be in the conversation very early on and saying to mum, this is how I'm thinking this is likely to go based on your age, based on your life experience, based on any comorbidity issues you might have. This is where I think it's likely to proceed. This is how I will do it if that goes there. What do you want? How do you want me to inform you about this? How can we keep you a part of the process? That's a really important inquiry that has shown very clearly that we need to do some work in relation to those models and midwifery models of care, and we need to give power back and a power balance back to patients. The Special Commission of Inquiry is a landmark inquiry, very unusual for governments to be willing to look at themselves like this, but I think this is an important inquiry coming out of 3 years of very, very challenging circumstances as a result of a global pandemic that our healthcare professionals and our healthcare systems were under. This is an opportunity for us to have a look at how we are funding using the $35 billion, and are we doing it as best we can, and are we making sure that it gets to areas where the healthcare needs are most acute and most severe. What we've probably traditionally had in health is a system whereby everyone got equal amount of pie, so to speak. I think what the inquiry will start to recommend is a focus on having a look at the population's health within a local health district, and then starting to match funding according to that need. And it's a little bit like the GP argument. Often people say there's not enough GPs. There probably is enough GPs. There's not enough GPs in certain locations is probably the more accurate view of the world. And I think the Special Commission of Inquiry will really start to unpack the way in which we fund our health and hospital systems in our district, and perhaps start to have a look at, from my perspective, what I hope they start to have a look at is how we can really drill down to the health needs of a given community. What is their level of health literacy? What are the gaps in their areas? And how we can actually lean into those gaps from a funding perspective. So these are the important inquiries, Anthony. A long way to go yet in terms of the recommendations, obviously coming out of the Special Commission of Inquiry, but we'll be working closely to deliver those as they're rolled out.
No, thank you. Thank you so much, Minister. And Minister, I'm aware that you have another engagement to get to, and I want to thank you so much for being so generous with your time this morning. And I also want to thank everybody who's been online and sending questions. We have enough questions for another 3 webinars. We will be putting the questions that we haven't had a chance to get to the Minister's office for a response, and we'll let people know about that. And Minister, we'd welcome opportunities for future webinars and future
100%.
discussions, and we'll be in touch.
Forward to it. Look forward to it, Anthony. Thanks a lot. Thanks, everybody.
Thank you so much. And thank you, everybody. And thanks for your participation in the webinar.